Good afternoon, Cedarfield family. Happy February 8th at 3 o'clock. Thank you for joining us today. We appreciate your gift of time. Those of you that are listening tonight, again, thank you for taking time out of your personal life to hear about 20 minutes of information related to Cedarfield. Format for today is very simple. Yours truly have 6 different topics to discuss. One is our current situation in the Commonwealth. Second is our dashboard here at Cedarfield. Third is a little vaccine distribution update. Fourth is some COVID-19 vaccine education. Fifth is a little bit about our preparedness plans. And sixth seems like we have 3 different snow events possible this week. And then we'll review any frequently asked questions from the residents. So first of all, here in the Commonwealth of Virginia, some good news related to the golden metric of the 7-day positivity percentage. Here in the Commonwealth, on February 8th, we are at a 9.9. We went from a 10.4 to a 9.9 from Friday. So that's just great news that we are below double digits here in the Commonwealth. In Central Virginia, we went down a full percentage point from 11.2 on Friday to now 10.3, so that's just great. In Henrico County, continues to be on the decline with the 7-day positivity rate. Friday we were at 9.7, and today we are at 9.4. Richmond continues to be on the decline as well. Friday was 8.7, and today we sit at 8.3. And then even Chesterfield went down a little bit from 11.7 to 11.5 today. So that's just great news. Of those 5 metrics, 3 of the 5 are now below double digits, which is great news. And all 5 of those metrics have decreased over the last 3 days. Some similar news on our dashboard here at Cedarfield. Some good news. Our North household, we continue to have 3 residents who are COVID positive. They're doing well. They're back from the hospital. And 1 resident cycled off of her 14-day quarantine today. We had 2 team members that cycled off of their 14-day quarantine as well. And so we have 0 team members with COVID-19 in the North household. In the Central household, again, we had a couple of residents cycle off of their 14-day quarantine, and we had 1 team member cycle off of her quarantine. So in the Central household, we have 1 team member remaining who will be under quarantine until the 17th of February. So the Central household is cycling off of their positive cases. In the South household as well, we had 1 resident who cycled off of her 14-day quarantine due to positive COVID-19 situation. And we had over the weekend 2 team members cycle off of their 14-day quarantine. So in the South household, as of today, we have 1 resident who is under quarantine due to working her way through the continuum of care, and we're just monitoring her through Thursday of this week. And then we just have 1 team member who remains had an in-home exposure and will be permitted to come back to work on Saturday. So the South household is also trending in the right direction. So north, central, and south households are all trending in the right direction. We're going to keep this particular floor, these three neighborhoods, as a red on the dashboard, particularly because there are people who are still COVID positive, but everything is trending in the right direction. So to all the residents and families and team members sending prayers their way, we do appreciate it. In assisted living, we have zero, our dashboard is green in assisted living. We have 0 positive cases. There are 0 tests that are pending. We do have 1 resident, again, who's under quarantine due to transitioning through the continuum of care. And we're just monitoring that particular team member through February 12th, or I'm sorry, monitoring that resident through February 12th, just to make sure that things are okay. We still have 2 team members in assisted living that are out and will be eligible to come back to work this week, one in the beginning of the week and one in the end of the week. These 2 particular team members have been quarantined due to an in-home exposure. So assisted living is green and trending in the right direction. Our memory support area is also green. It's a green dashboard with residents and team members. Independent living is the same. In the main building, there are 0 residents with any cases, positive COVID-19 cases, or any pending tests, and the same in the cottages. So all of that is good news. In housekeeping, we finally did cycle off of the outbreak that we had in January. Those team members are now back to work, and so Sharon Brown has a full complement back at work. There was one thing that popped up last week with an in-home exposure, a very minor event that team members not due back until this Sunday coming up. But all intents and purposes, housekeeping is back to a green dashboard in my opinion. Resident services, which is lifestyles and wellness, that dashboard is yellow right now. We have 2 particular team members who are out because of an in-home exposure, and we're tracking those 2 particular team members in the lifestyles and wellness area. Marketing, again, there's 1 team member with an in-home exposure. That team member is due back here next week. Pastoral services dashboard is green. Maintenance dashboard is green. Administration's dashboard is green. Human resources and the business office dashboard is green. In dining services, things are looking on the up as well. In dining services, we had a couple of team members towards the tail end of last week cycle off of their 14-day quarantine. We have remaining 5 positive cases of team members from last Monday, so they're going through they're halfway through their 14-day quarantining protocols. And then we will test dining services here over the next 24 hours, as we've been doing here for the last month, making sure that through weekly testing, we're monitoring folks that are asymptomatic and seeing if there's any other positives in that dining area. A little bit further into this live chat, talk a little bit about Virginia Department of Health's visit here this morning. So in summary, we have 5 residents that are COVID positive. We have 10 team members that are COVID positive, and we have 3 team members that are quarantining due to an in-home exposure. There are 0 residents in the cottages with any COVID-19 positive cases. Same as the main building, there are 0 residents with any positive cases. In assisted living and memory support as well, those areas are green with 0 positive cases. So it's a big week this week. We are, Renee and everyone that's been planning for this week for the second vaccine are just so incredibly excited for everyone that is listening. Those of you that live in independent living, those of you that live in assisted living and memory support, and 19 of our Pinnacle Advantage members will be receiving your second dose on Friday. We are very excited. We got off the phone with Walgreens not too long ago, and the weather pattern that is trending towards the tail end of the week is not deterring our pharmacists. They do have a nice complement of pharmacists, as they did on the first round, coming back for the second dose, so we're pretty excited about that. And which is Friday, the 12th. So we intend to publish, Renee and I intend to publish a memo by tomorrow at noon, which outlines which apartment number or cottage number or Pinnacle Advantage section is to come to certain locations within Cedarfield at specific times. So one thing we did learn from last time was the fact that the pharmacist did not reach the clubhouse in time to be able to put shots in the arm right at 9 o'clock. So we're going to be stressing to the Walgreens team, can we please make that happen so we can stay on schedule? The second thing that we noticed is that at the top of the hour, when we listed a range of cottages and or apartments, due to the excitement of wanting to get the vaccine, which we can all just be, we're all equally as excited for residents to get it. Everyone came at the top of that hour, so we're going to break things out a little bit more specific by the half hour and lump in groups of cottages and or apartments. So not everyone's coming at the top of the hour. We're going to break things out a little bit more. So that memo, again, will come out tomorrow to outline the flow of Friday. We did count the number of vaccines again this morning, and it looks like we're going to be well into 525 vaccines for Friday, so it will be a busy day. And then on top of that, we have snow coming Thursday into Friday. So we have a snow event. Seems like the snow is starting at 2 a.m. on Thursday, all the way through Friday at noon, if I'm looking at some of the weather apps appropriately. So we're going to plan for that and making sure that the weather does not deter us staying on schedule and providing 525 vaccines on Friday. So good news is, some more good news, the team members that received the vaccine last week, we had very few, we had 2 call-outs, I believe, over the weekend of team members really not feeling that well. So that's a really great percentage given the participation rate from last Thursday. Just as a friendly reminder, we had 285 vaccines distributed last Thursday. 40 additional team members who had said yes for the first dose. So it puts us well beyond the, well not well, but it puts us at a 73% participation rate with the team members, which is just great. The national average within nursing homes, assisted living communities, and or retirement communities around the country rests right now at about 37%. One thing about COVID-19 education, over the weekend we received many emails and texts about providing a vaccine incentive for team members. Could you pay team members, I had one email say, can you pay team members $500, $1,000 to get the vaccine? And just wanted to address that so maybe we can just all be on the same page. We, the management of Cedarfield, along with the Virginia Department of Health and our Pinnacle Living Office, have been working tirelessly over the last 2 months providing sound education for team members in written format, in live educational sessions, in YouTube presentations. We have helped, at this community, have helped 310 team members with sound data around the vaccine. And I have to say, I'm really proud of the people who provided that training. Connie McGowan, Ann Hopper, the clinical leaders of all the neighborhoods, the neighborhood leaders, all the department directors, the managers, and even many of the spouses of team members who don't even work here, helping their loved one cross the finish line due to a lot of the education that the team member actually went home with to help the household understand how safe the vaccine was. And so really, we believe that 73% is a great number. We want to honor choice still. This mandate of this vaccine hasn't really fully reached the court systems yet, and so we are not mandating that the vaccine be distributed to residents or team members. So we believe education was and still is the #1 priority for Cedarfield with team members. We did encourage team members that if they came, that their name would be placed in a drawing for a free vacation day. And the other thing we had mentioned to team members is that at the end of the vaccine distribution, if you are one that did receive the vaccine, we intend to have a rally day where we'll probably have a food truck arrive in March, early part of March, and celebrate accordingly with a nice hot meal. And we'll receive feedback from the team members about which lunch truck they would like to arrive at Cedarfield. In addition to that, we have really uplifted the whole process. At the end of many of the memos here recently, we said educate, vaccinate, and celebrate. We've really honored the team members who have moved forward with the vaccine. We've tried to create a very uplifting environment in the fellowship hall and the dining room and healthcare to celebrate the fact that team members did receive it. In addition, the vaccine in and of itself to me is an enormous gift to not only the residents but certainly the team members. And because of all the education that we have been providing team members, there's many of us that really hope that the team members think that this vaccine is also a gift, that medical science started in Germany, came across the pond, so to speak, and all the way to 2300 Cedarfield Parkway, and now that vaccine, and 73% of us, is keeping us safe and well and alive, and while doing so is going to protect the residents of Cedarfield. And so that vaccine, we believe, is just an enormous gift as well to the team members. We've been told time and time again that over 70% is a really healthy number, and then that can begin a conversation with the Virginia Department of Health on what we can and cannot do in unfolding services back into the landscape of Cedarfield, which we intend to do. The Virginia Department of Health, there was 2 epidemiologists that arrived here this morning to review our dining services areas, our main kitchen, and the protocol that they are following in order to keep themselves safe, keep everyone around them safe, and keep the food safe while cooking it, preparing it, and packaging it. The 2 epidemiologists were here about 90 minutes, and quite frankly, they had glowing things to say with what we were doing. They will issue a final report here over the course of the week. They did make some minor suggestions, which we are providing more education for the team members. Things like when you're wearing 2 masks and you have a face shield on, and you're doing that consistently for 60 minutes, we might want to provide a little bit more breaks for the team members, particularly in a kitchen where it's really hot. Those type of things to make things more comfortable for team members. And they made a couple other suggestions to make the flow more efficiently in the kitchen. So all in all, they were very pleased. Connie McGowan, hats off to Connie, our infection control nurse, who was at the helm of leading the tour with them and answering all their questions about what we're currently doing. So thank you, Connie, for your leadership. And once I find the formal report, if there's anything in there that residents can also benefit from, we'll make that known here during the live chat. I was expecting to talk with the epidemiologist today to talk a little bit about services and amenities of Cedarfield. I quickly learned when they arrived here that those epidemiologists that were here are really only dining services specialists. They're not epidemiologists that review your entire preparedness plan. So I apologize, but I did make that remark last week that we were going to learn a little bit from them today about what to unfold here moving forward. I do have a call into the epidemiologist who is in charge of the overall preparedness plan along with Cedarfield, and to see if there's a time that we can chat later this week about 4 main questions that so far I've come to learn are really important to team members and residents, and they are as follows. 1, once we get to a 90+ participation rate, when can we fold in visitation for residents to Cedarfield, and how does that look like? Secondly, group activities around Cedarfield. What does the lifting of some of those restrictions look like instead of needing to be 6 foot apart from one another in close indoor spaces? Third is, what about travel? With residents and team members now provided the vaccine and 95% effective, what does that look like for residents and team members traveling around the United States and visiting their loved ones and friends? So we want to get a little bit more guidance on that. And then lastly is dining services. What is over the last 10 months, we've been working on some restricted protocol, obviously in the restaurants, and a majority of the last 11 months have been with a takeout service. So we really want to understand how close can we come back to life as normal in dining services now that 90+% of us have the vaccine and we have herd immunity. What does that look like? So those are our 4 main questions. If anybody has any other main questions they would like to add to my list, please feel free to email me or call down to the administration suites. I think that is it for me. Do we have any frequently asked questions coming in? None? No questions. Eddie, do you have any questions? Renee, do you have any questions? Hearing no questions from the crowd in the fellowship hall, and seeing that there's no questions coming across text, let me check my email real quick. One email which I addressed already. I think that's it. Okay, no questions coming in. We will see you on Wednesday at 3 o'clock. So thank you for tuning in to this live chat today. We appreciate your gift of time. If anyone has any questions about today's information, certainly feel free to call down to the administration suite, and we will address any and all of your questions just as soon as we can. If you are watching this video tonight, please feel free to call my cell phone number. I can answer your questions tonight, which is 727-479-5290. Hope you all have a great night and a great day tomorrow. If I don't see you sooner, we'll talk to you on Wednesday. Thank you.